I know. It's just,
Okay, moved up.
it's not going to the board, it's going to the
Elevated,
committee.
okay. All right, we'll call the meeting of the Human Resources, Finance, and Property Committee to order. First item on the agenda is the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Any public comments? Nobody has approached the clerk or myself. Any public comments? Any public comments? If not, we will move on to the approval of the minutes from the August 10th meeting, which were in the packet. What are your wishes? Moved by Supervisor Lemmer, seconded by Supervisor Hart. Any discussion? If not, all those in favor of approval of the minutes of the August 10th meeting will signify by saying aye. Opposed, no. That motion carries. Without objection, I'd like to take the audit up first, and then we will, again, without objection, the discussion on the health insurance. So if we could, is there? All right. So Christy, do you want to cue it up?
Sure. Hi. What we will do is we will start on page, I believe it's page 12 of your packet with the Marathon County financial highlights. And we have with us today John Rader, who is our director that's in charge of the Marathon County audit. And he will be going through a few of the items in your packet. What you have is financial highlights. And with that, he'll give you a little, for those of you that are visual learners, there's some charts and graphs and some dialogue to kind of tell you where we are and where we stand in relationship to other counties. After that is the what we call the management letter, and then the audited financial statements of Marathon County, which are packed full of numbers. And so however you understand and interpret numbers, we're going to try to get them to you today so that you can understand our position and where we are in regards to our financials as of December 31st, 2021. And with that, John is virtual, and their offices are down in Madison, Wisconsin, but they do have auditors throughout the state of Wisconsin that work with us, and I will let him start with the financial highlights.
Thank you, Christy, and thank you to the committee. Can everybody hear me okay?
Yes.
Okay, great. Yeah, thank you so much for having me this afternoon. I understand there's some new committee members, so for those of you that are new, as Christy mentioned, I'm John Rader. I'm a director with Baker Tilly, and I've been working on the county's audit for a number of years. So I am going to run through some graphs that I think are part of your packet, but if not, I'm also sharing my screen so you can just watch along with me if that's easier. I'll mention a few things at the outset, but if you do have questions, don't hesitate to stop and ask me. I'll do my best to answer them. If it's more detailed, I'll probably defer to Christy, but we'll get through any questions you may have for the next 5 to 10 minutes. So before I do walkthroughs, I just want to mention, what is an audit and where are we at? We actually do it in phases. So we start what we call the preliminary phase for a couple days. We did that last winter. I think it was November or December, where we are working with a team and Christy's team, and we're testing controls. So we're payroll and how you process AP transactions and journal entries and a host of other things. And we do a lot of walkthroughs of areas like how do you collect taxes and administer grants and such. And we're also working with the decentralized departments such as CWA, your component unit, solid waste, and a number of others, human services, just updating our understanding of what's gone on, what's changed for the year, testing those controls so that we can rely on them when we come back. And we do come back for an entire week. This year, it was the last week in April. And so at that point in time, we are focused on testing those balances. And so at the end of the week, we were, probably 85% of the way done. And for the next couple of months, we finished up those remaining items that needed to be tested as they're ready. And we also drafted the county's financial statements. And so then we issued that draft for Christy and Susan and their team to review, make sure it's consistent with their records. We kind of go back and forth on some things, and then we finally issue final financial statements. And we did that just a few weeks ago on July 27th. That's kind of a critical time because the Department of Revenue has a deadline where the Form A or the state report, as it's known, needs to be submitted in conjunction with the report that we issue that reconciles that to the audited financial statements. So we made that deadline, and that's always good news. So we actually do 3 different audits for the county. We do the financial statement audit, which I've been talking about. And one additional thing I want to mention about that is we issued what's called an unmodified opinion. It equates to a clean opinion, basically means your financial statements are prepared according to the accounting rules or GAAP. The other small audit we do is out at the airport. And so we work with David out there, and the FAA requires an audit of the passenger facility charge that they collect, $4.50 per enplanement. That accumulates throughout the years. The airlines pay it in, and it needs to be spent on very specific areas. So we audit both the collection and disbursement side of that. There's also some compliance that goes with it. And we issued that in final just a few weeks ago as well. Didn't have any issues there, no compliance issues or anything. And then the third one is a single audit, and the testing is done for that. We did that in early July. That's a compliance-based audit of your federal and state awards. And as you're probably aware, there's a lot more funds flowing through these days with the COVID-19 and the ARPA funds. So there's more to test, more programs and such, and more complexity too. So that's being drafted this week, actually, and we'll be issuing a draft to the county for the review of the next couple of weeks and issue it in final before the deadline at the end of September. So that's a little bit about the process. We issue another document that we refer to as the audit results. It's commonly referred to as a management letter as part of our audit, of our financial audit. And I won't walk you through that, but I will mention a few things. It talks about, in the very front of it, what our responsibilities are. Because I think quite often there's a misunderstanding of what is it, what was done for the audit. Because there's a lot of different types of audits. There's forensic audits, internal control-based audits. This is really a GAAP-based audit of the numbers. So it talks, like I said, bullet points out what our responsibilities are to achieve that. And then it goes on for 3 or 4 different pages about some required communications. You'll see this in all audit reports. This would be like things that came up during the course of the audit, where there are disagreements or problems or anything like that. There's nothing of that nature in there. The one thing I do want to mention that is it does say that there were no new accounting rules or GASBs that had to be adopted this year. GASB gave all the governments a break because of COVID-19. Unfortunately, it didn't stop. So there's a whole bunch more, about 10 more coming around the bend. And that's another few pages in that report. The 2 that I want to mention are GASB 87. That's regarding leases. And that's going to be effective for the county in this year, 12/31/22. This is a really complex, involved GASB that will definitely apply to the county, probably in multiple areas, certainly at the airport, where there's going to be a lot more accounting for leases, a lot more disclosures. And like I said, it is fairly complicated. So we've been talking to Christy and her team about how to prepare for this for the last couple of years. And there's some language in the management letter audit results that explains it in further detail. The other one I want to mention is 96, and that's the subscription-based IT arrangements, and that's going to be effective for the following year. So these are things that are very common, that if 87 doesn't capture it as a lease, 96 probably will. So think CAD systems or cloud-based software applications. There's commitments related to this, and this accounting rule will require those to be recorded. The last thing I want to mention that's in there is, of course, the internal control matters. And that's where a lot of people focus on when they do look at this report. I'm happy to say that there are no new comments in there. There's one carry forward comment, just the fact that we prepare the county's financial statements, and we have some material entries for that. So there's a comment on financial reporting at year end. This is in 90-some% of our reports for governments. It's just, it's very common these days for governments just not have the internal resources or time to prepare a full set of GAAP financial statements. So we do it for almost all of our clients. There's actually 4 items that were resolved this year, which is good news always. So those will disappear next year, but they're regarding bank reconciliations, cleaning up some accounts basically, and they're monitoring spending down of bond proceeds, and one other. So some nice progress in that area that we were able to see this year. And then a couple carry forward comments for things that are just more, they're not material weaknesses or significant deficiencies, but they're items that we still feel should be brought to the attention of management. And again, those are related to decentralized cash accounts that are in existence, just looking for a little bit of additional control on those. And something you're very well aware of and are addressing at the current moment, and that's your financial accounting system is just not, it's not user friendly, as we're all aware, too keenly aware of, but it's also, we like to see some controls that are in existence, being able to provide budget to actual reports that a committee like you could take a look at and ask questions, as well as department heads and such. And that's quite cumbersome with the current system. So that's been in there as well. That's the only thing I had to mention on that report. Any questions on that? If not, I'll talk about the numbers.
Before you move on, see, is there a separate audit relative to the ARPA funds does that need to come before this committee before it's submitted to the Department of Treasury?
Not that I'm aware of. We've been doing it for years, and we do it for other airports too. I've never seen an actual committee approve it or anything, unless there's something internally.
No, they've always been incorporated in our financial statements because they're a discretely presented component unit within those, so they are incorporated in that. The PFC audit report is something that's new in the last, 5-10 years, and that's a separate recorded.
Yeah, 5 years, I'd say. Yeah. Okay.
Take us to the numbers.
All right. Talk about the numbers. The more interesting stuff, right? So we prepared these graphs just very similar to what we've done in the past. It beats the heck out of flipping through a bunch of pages in the financial statements. So this first graph, as you can see here, is focused on the general fund balance, okay? And as you know, it's your primary operating fund. And in fund balance reporting, you can have up to 5 different categories. And the county has 4 of those. And so I'm going to start at the very bottom here. This non-spendable category, the green is 2021, the black is 2020 for comparative purposes.
John,
so
do you want to flip back
yep.
a page? Yeah, one more.
Back to here.
One more. Perfect.
That's interesting because I can't see it when it's there. Good.
Christy, do you have
I
this?
think the page he's showing is in the packet.
It's not.
Yeah, Christy, I can stop sharing mine.
It's page 13 in your packet.
Looked like what was there on the screen.
There it is. Yep.
Okay.
Okay.
Go ahead.
I think we have it now.
Okay. Okay, great. Thank you. Thank you for the update. So of the 4 different categories, just talking about the non-spendable portion at the very bottom, you can see the 2.8 million for 2021. Almost all that represents amounts that are the non-county portion of the delinquent property taxes. So just as we've seen for a lot of counties this year, that went down a little bit from the previous year. That's considered long-term receivable because of the collectability of it. And so GAAP says you have to set that aside as non-spendable. So it's not liquid, so to speak. And then there's 1.4 in restricted. And that's, again, very close to last year. And that is split between some amounts that have been in there for many years for the UW dorm maintenance on that campus. And then by statute, some land records amounts and some jail assessments that have been in there. Again, these are all external restrictions. Nothing in committed. And then assigned went up considerably, went up about $3.7 million this year. There's the amount that has been in there from the HEC power line easement, compensated absence, so accrued vacation and sick that the county sets aside funds for very appropriately. But the big increase was because of $10.7 million that the county applied towards the 2022 budget. Okay. And then everything else ends up in unassigned. So that went from 35.8 down to 34.1. So that went down 1.7 because you're unassigned. Like I said, your assigned went up 3.7. So overall, your fund balance increased by $1.4 million for the general fund for 2021. It got there. You can see a very summarized or high-level income statement in the middle of this. Your revenues came in about 6.8 under budget, but your expenditures came in about 21 million under budget. Taking a look at the detail, and this is in a budget to actual schedule in the back of your financial statements on pages 80 to 86, but taking a look at the detail that's earlier today, for revenues, again, it was under. Your sales tax were actually over budget, which again, we have seen this in all the counties we've been auditing this year. And conservative budgeting, and it just came in stronger. But that was over by 2.1 million. State grants were under by $2.7 million. And investment income, because of the governmental securities that you hold until maturity, the gap says you have to market that had a loss. Those had a loss this year of $2 million. That's really, think of that as a gap adjustment versus an actual cash loss, because you will hold on to maturity. And then they plan to use a fund balance or spend on that in the fund for the year. Expenditures, again, looking at that, many departments were under budget this year, primarily in the area of personal services, so salaries. And there was a significant underage in the area of capital by about $13 million. So that's what drove the expenditures for being under. So again, your general fund was up by $1.4 million overall for the year. What does that mean? And if you flip to the next page, you can see how we plot that out. And we've done that for the last 5 years here. So a common metric is to take a look at the unrestricted fund balance. So that would be your assigned plus your unassigned, because you have complete control over that. Compare that to what your expenditures, your budgeted expenditures, I should say, are, and that gives you this percentage. So for the end of 2021, you ended up at 54%. Another way of looking at that is if you don't collect any more money throughout the year, the following year, how long could you continue to pay those budgeted expenditures or costs? In about half a year. And that's been pretty consistent overall for the last 5 years. Some fluctuation in there, but not much. And you also have a policy that's spelled out there. And it's a working capital policy, really, that says the budgeted expenditures of those three funds, the general, social improvement, and debt service, applying 8.3% of that. We used to report that as a separate category on the face of the financial statements, but one of the accounting rules said you can't do that anymore, you change it, but it's still an internal policy in the way you track it, and there's a footnote disclosure on it. But that is in your unassigned fund balance. So again, pretty consistent, solid fund balance level, and no concerns there. All right, going down to the next page. So this page and the next one focus on debt of the county. And in Wisconsin, as you know, municipalities and counties are limited to 5% of the equalized value as far as the amount of general obligation or tax-backed debt that can be outstanding. And so that black line represents what that limitation is. That's your debt limit, again, based on equalized value. And so that went up to 638 million. So it's up 3.1%. So nice, steady increases, as you can see from year to year. The green line below represents the amount of GO debt outstanding. which was up to 64.8 million at the end of the year. So at the end of 2021, the county was utilizing 10% of its debt capacity. Last year, in 2020, that was 6.8, and in 2019, it's 3.1%. So as you're more aware than I am, the county's been issuing debt for North Central, and there's some airport debt in there too, but with the growth, with the improvements over at North Central, and that debt being on the county's books, that's why that's gone up. But 10% is that is not unusual for larger counties that we audit in Wisconsin. There's, anywhere from 5 to 10 to 12% is not uncommon, but I know there has been some growth at the county level. Down below there, you can see the different various forms of debt. Again, the 64.8, and that includes airport still, as you can see laid out there. So capital lease, the forced crop loan, and compensated absences that we talked about earlier, those accrued benefits. Okay. We used to put information on here of other places that we audited, but that became challenging. But you can, actually not other places we audit, there were some statistics that the Wisconsin Taxpayers Alliance put out, but now the Wisconsin Policy Forum, they changed the way it's presented, but there still is really good information out there. If you go to that link that's at the bottom, you can see how their county compares to other places if you're interested in those kind of things, all kinds of statistics actually. And then on the next page, another way of looking at debt is how much do you pay in debt service compared to all your other governmental expenditures. So this is not highway, this is not solid waste landfill, this is not airport. These are just your governmental funds compared to all the other costs that run through those. You pay just over 3% in debt service. A good benchmark to think about is you want to keep that below 20%. Counties are always going to be well below 20%, and 3% is well below. I didn't put any data on here, but obviously the county has a lot of other funds. I'll just tick through them quickly. Your social improvement fund increased its fund balance this year by $3 million. Capital fund was up 4.1, but that largely represents unspent bond proceeds for ongoing projects, North Central. Landfill had a loss of $903,000 this year. Highway was up 1.7, and airport was up significantly, 13.6 million. And that's in large part due to the COVID funding that's come into there and the AIP, airport improvement projects that get contributed by the Fed and the state. All right. Any questions on the numbers or anything else for that matter?
Are there any questions for John? Go ahead. There's no questions.
No questions?
Yes. There are no questions.
Okay. All right. Well, I want to thank you for having me. I want to thank you, the county, for having us as your auditors. We certainly enjoy working with everybody, and it was nice to be back up there this year with our team.
All right.
Thank you very much. And again, if you do have any questions, sometimes when you look at a lot of numbers, you think about them. So when you're driving home, if you have any questions, you can email me or Supervisor Robinson. Will get those questions back to John Rader too. So thank you very much. Thank you, John.
Thanks, everyone. Thank you.
Next, we'll turn to Molly. Do you want to do the introduction?
Is it on? Yeah. Good afternoon. So with us today is Eric Torberg with USI. We've been working with USI to review our employee benefits, and Eric is going to walk us through a presentation that begins on page 5 of your packet, specific to our health insurance.
Good afternoon, everyone. As Molly said, I'm Eric Torberg with USI Insurance Services here in Wausau. We were engaged from Marathon County in May of last year to begin working with them on a day-to-day basis, as well as a strategic direction for the employee benefits of the Marathon County employees. So the presentation is relatively straightforward, so certainly if you have any questions, let me know. The first slide talks about the current state versus self-funding. So when we think about the current state of the Marathon County employees, you're currently with Group Health Trust through the Wisconsin Counties Association. You pay a fully insured like premium on a monthly basis with no fluctuation. So the trust itself is made up of public entities within the state of Wisconsin that pay into the trust, and then all the medical and prescription drug claims are paid out of that trust. So technically it is not a fully insured contract like you might have for your auto insurance or what have you. It is a self-funded trust, but the way that the county is charged, it looks fully insured. So I don't want to get overly complicated on the difference between a trust and a fully insured contract, but that essentially is what it looks like, is fully insured. So no matter what happens month to month from a claim perspective, meaning if the county has a very large claim one month for a long hospitalization, the amount of premium stays the same month to month. And then every year it comes up for renewal in January. So as we look forward to January 2023, this is what we're talking about today. Now let's switch to self-funding. So most employers, the size of Marathon County, which the size of your people on the health plan is about 650 employees that are enrolled in the health plan. Most of those size employers are self-funded. There are certain advantages to being self-funded, and this slide goes through some of those. The first and foremost is an employer that is self-funded is flexible with their plan design. So how the deductibles are set, how certain things are paid. When you're self-funded, you have ultimate flexibility. You can customize it however you see fit. When you're in a trust or a fully insured policy, you're restricted on the specific benefits that you can do to the employees. Second is you have the ability to maintain control over the reserves. So I talked about if in 1 month you have lower than expected medical and prescription drug claims, that is a reserve that finance can book as a reserve for you, and you don't have to pay interest income on that. It's your money. So every month you only pay the medical and prescription drug claims that come in the door. So through Aspirus or Marshfield Clinic or what have you. Third, you don't prepay for coverage. So I talked about that on every month. It's the same amount every month. So that's considered prepayment. So every month you're paying the approximately $1 million a month for the health insurance and prescription drugs. If the claims are lower than that, it doesn't matter. You still pay the $1 million. Some other benefits are tax benefits. Fully insured plans have to pay a tax, a 2.5% tax within the state of Wisconsin. When you're self-funded, you do not have to pay that 2.5% tax. So those are the main advantages of being self-funded. The next slide talks about the components of a self-funded plan, and there are 3 main components. The first is the third-party administrator. And what they do is they process the medical claims. So UMR, which is located here in Wausau, is a third-party administrator for health insurance. All they do is they process medical claims. The second component is a pharmacy benefits manager. They process the pharmacy claims, and they also negotiate the cost of the drugs. So they're considered a middleman between the manufacturer of the drug and the pharmacy. So that's where the pharmacy benefit manager comes in. And then the third component has to do with the risk to Marathon County. Because you would be self-funded, you would have risk if there are high dollar claims. If there's a claim that comes in that's $1 million, you would have to pay that $1 million. But there is insurance that the county can purchase called stop-loss insurance, and there's 2 components to that, that protects the risk to Marathon County. First is specific stop-loss. What that does is that protects you from high dollar claims. So I talked about the $1 million claim. We would set a deductible prior to going self-funded of, let's just say, $150,000 per individual per year. So any claim over $150,000 per individual per year would have insurance behind it. So that would protect your high-end risk if there happens to be those types of claims. And there always is for a group of your size. The second component is aggregate stop loss. And what aggregate stop loss is protects your overall liability. So the stop loss insurance carrier would project your claims for the year, your aggregate claims. So they may say your projection is $11 million in claims for the year. So then they would protect you beyond that projection. If there happens to be a bunch of claims that come in that weren't expected, you would have insurance for that. So when you're self-funded, there are still ways that you can protect your overall liability. Some more understanding as far as the difference between a fully insured plan and a self-funded are these two bar graphs. So the left side is what a fully insured plan and all the things that make up the premium dollars that you pay in a fully insured plan. The first and foremost is carrier profit. So insurance companies make money, as obviously everyone is aware. Second component is margin or potential profit. So when I talked about if your claims are lower in 1 month than what they expect, the insurance company keeps that difference for that month. So that is where that margin comes in. Third is mandated benefits. Each state has mandated insurance benefits that the insurance carrier has to follow. When you're self-funded, you do not have to follow those. When you're fully insured, the insurance companies have to offer those specific mandated benefits. I talked about the premium taxes and ACA fees. When you're self-funded, you don't have premium taxes on the entire premium amount, so you save money through that. Other components of a fully insured contract are pooling, which are those high dollar claims. Second is administration. So the insurance company does charge you a percentage of their total premium is considered administration, what it costs them to process the claims. And then the lion's share of the premium dollars that a fully insured contract pays is in the claims. So when you think about total percentages, 80 to 85% of the total cost of premium is in the claims. So when you compare that to self-funded, which is the right graph, you eliminate obviously any insurance carrier profit. Because if the claims are lower in an expected month, the Marathon County would keep those savings within their reserve. You would pay taxes on the premium paid for stop loss insurance because it is an insurance product. You pay taxes on that. And then obviously you would pay premium for the specific and aggregate stop loss. You would pay a third-party administrator a fee to process the claims, and then you would pay the claims. So those are the differences as far as the cost components of self-funded versus fully insured. The next slide talks about probability and risk. Because you are taking on the risk when you are self-funded, there is always a concern that that increases your opportunity to lose money year over year. So USI looks at things on an annual basis, and we look at groups of specific sizes and see over a 5-year period, 3-year, 1 year, what is the probability that they will lose money going self-funded versus fully insured. So this line graph looks at, and there's 2 pop-ups. So the first one is 100 life group, which you are significantly bigger than that. Over a 5-year period, they have a 90% chance of saving money being self-funded versus fully insured. Now, a group of Marathon County size, which is approximately 650, the second bubble, you have a 97.5% chance of saving money being self-funded versus fully insured. So those are real live data that we look at throughout our entire book of business that we manage. So when we look at the next slide, it's the cost comparisons. So I talked about the first 2 are the group health trust. So today, as of today for 2022, based on the 650 employees, it's about $12 million a year that you pay in premium to group health trust for both health insurance and the prescription drugs. As of today, Group Health Trust has offered the county an 8.5% increase. So that represents approximately $1 million over a 12-month period. So next year, everything stays the same status quo, we would be looking at $13 million versus $12 million. As far as self-funded and what the market is offering, that would be more along the lines of a flat increase. So instead of that 8.5%, self-funded options would provide a flat increase or 0%. So based on all of what I've talked about, USI, obviously, the county engages USI for a recommendation on a year-by-year basis. So our recommendation, based on the number of employees that the county has, 650, I talked about most employers like size are self-funded. Due to the GHT increase of 8.5%, our recommendation is to explore and move to a self-funded option for January 1st of 2023. That'll allow you flexibility in plan design as well as cash flow advantages on a month-to-month basis. So our recommendation is to move to self-funded for January 1st, 2023. Any questions?
Kurt?
Yes, sir.
Thank you for that presentation. So a couple of questions. I mean, obviously, if you go and you look at stop loss and stop loss coverage, if you have a major claim and the stop loss carrier, whoever that may be, whether it be aggregate or whether it be individual, is going to pass that premium on to us the following year if we have a major claim, correct?
That is correct. What we do when we negotiate stop loss contracts with the stop loss carriers is we insist on a second year cap from a premium perspective, so that we can say, you know, they will not exceed a certain percentage for the second year if there happens to be a large claimant like that.
But the third year, then you're at risk at market.
Correct.
So
Correct.
I guess my point only is simply this, is there is risk when you go self-insured, and that's the stop loss cost. We can say that we're going to try to protect that stop loss and the potential loss to based on numbers and percentages, but the fact is there's still risk. And this county historically, previous, used to be self-insured, went to GHT to try to, because it is a trust, it is not a fully insured carrier, and the managed theory was they were managing that risk amongst the trust and amongst the members in the trust. I did have a discussion with Mr. Lamont at GHT this afternoon, and he is also, you know, obviously in the contract we have a 8.5% maximum on the second year of this contract. He has said that, you know, we've had a long history. That was the recommendation from the underwriters. He's going to go back to the underwriters and see if there's another opportunity to look at this and see what numbers he can. So he's not convinced that the 8.5 is final at this point, but I just wanted to pass that along. And then looking at the self-insured, so because another entity that I chair the board for is self-insured, and if they do not put a large enough increase in for their self-insured carrier based on historic coverages, they can run into very large trouble also, because you have an aggregate stop loss, but you have a individual stop loss, correct?
Yeah, so the individual stop loss is the specific stop loss I was talking about. Yep.
But if you have a large amount of claimants, meaning lives actually, claimants that do not hit the actual individual stop loss, but then you hit the aggregate, effectively you could put the self-fund into trouble also, because That's what we're seeing now in another entity that I chair for, is they were significantly underfunded, and they're now looking at a 20-some% increase that they're needing to fund for when they funded an 8.5% increase last year, and they're self-insured.
Yeah, that's why each year, we go through a lot of diligence as far as actuarial values and projecting the claims from year over year so that you don't get into a situation that you're underfunded, because that's where you can run into those issues. But we want to make sure that we're very specific on what the projections are versus what the liability is.
So the other question that I have is, because historically, if we're looking at claims data from the last 12-month period, which obviously encompasses the pandemic, and some services were not available, and I guess the question becomes, are we setting ourselves up for a potential risk where there's going to be more claims because some of the services weren't available in the last 12 months because of the pandemic itself? And I throw that out there because I've seen in some places that that's the case, where their insurance was, or the coverage was underutilized because of availability of service. And so we're setting ourselves up with historical data in the last 2 years that is not representative of true claims that a group of this size would actually see if all services were available. Does that make the question make sense?
Yeah, it does make sense. I mean, there was always a feeling through the pandemic that there was a lack of people accessing care through the pandemic. And the main concern was that care that was pushed off into the future was going to cause more issues because they got sicker and sicker and sicker. From a USI's perspective and the data we access for all of our clients across the United States, we're not seeing that as of today yet. We're not seeing those increases based on that as of yet.
But there's the other part of that component is the actual claims that were being paid because the services were underutilized also. And setting ourselves up for potential problems because we underfund because the actual true day-to-day services and preventive services were underutilized, and so the actual claims payout from the historic standpoint through the pandemic was lower than average.
Yeah, and what there is some truth to that as far as obviously people not accessing care. What we will do is we'll actually look at a 5-year period to help even out that fluctuation.
Okay.
So our workforce has changed dramatically, partly because of COVID, partly because of aging out, and partly because of better opportunities elsewhere. And Molly, what's our current percentage of our employees with 5 or less years of experience?
44%.
So as we look at as a younger workforce, does that have a consequence relative to traditional risk and expense relative to health insurance?
Yes, I mean, statistically.
In what way? Because you've got potentially more births,
Yeah,
less
I mean,
heart attacks.
so the rule of thumb is always younger females may be more expensive than younger males, but older males are more expensive than older females. So if the demographics are, and the reason for that is maternity more than anything, because it's the most common larger claim that you will have. But overall, from a large claimant perspective, and I'm talking about risks like cancer, age is the predominant demographic that's going to drive that. So the older workforce you have, typically the more unhealthy you will be, and consequently more expensive.
So the
that
other
answers.
thing, and Gail, excuse me if I'm going to steal your thunder, but the assumption is we go from one system where basically we have negotiated rates to another one without necessarily some price shopping and comparisons and innovative approaches relative to purchasing services at a discount or whatever within the plan. Have you seen self-insured plans where they've gotten more aggressive and involved in the establishment of workplace clinics and what does that do to their premiums?
Yeah, so, the larger employers, when you think about our community here in Wausau, the larger employers such as Greenheck, such as Colby and Colby, et cetera, they do have on-site clinics. Marathon County has a health and wellness center as well. That can only positively impact because those individuals are going to the clinic and not getting a charge for a claim. You're not getting an explanation of benefits from Aspirus or from Marshfield Clinic. So there are those inherent savings going through an employer clinic where the employer is just charged a flat amount for the employees to see that.
Supervisor Marshall, you've had your hand.
Yeah, I just, I noticed that the 650 employees and the $13 million comes out to be about $20,000 per insured individual. And just wondering how that compares to other employers. Is $20,000 considered adequate? Is it considered over what you see on average?
So
Under?
when I consider public employers, that's right in line. When I consider private employers, that would be higher than a private employer. So a private employer might be in the $15,000 to $16,000 range, and public employers sit at that high teens into the 20. And mainly that is because the plan design is typically richer, meaning the deductibles are lower, the out-of-pocket is lower than in the private sector.
Kurt?
So you hit on a point that how does plan design enter into costs? Because obviously, if we're going to shift responsibility under a self-insured, because we have the flexibility in the plan design, and we potentially reduce benefits to employees to effectuate savings on potential premium, self-insured costs. How does that impact the recruitability of employees in comparison to private sector versus public sector? Because obviously we have to be competitive in the private sector, in the public sector, because that's what we're recruiting for. And so the question becomes, if we under-design or perform in our benefits, is that going to be negatively impact the ability to recruit?
Yeah, so, and Molly, you can jump in here as well. So every year, USI conducts a benchmark study. So we send out invitations to employers throughout the United States to participate in this benchmark study. Some would be public sector, some would be private sector. This year, we had over 8,000 employers throughout the United States that participated in that, as well as in the state of Wisconsin. And we're able to report to our clients, such as Marathon County, by industry, so by county government, by size, by region, and offer what other employers are doing on average. So we looked at deductibles, we looked at out-of-pocket, we looked at plan contributions, so what the employees are paying out of their paycheck. We even looked at vacation, we looked at everything, and we reported that back. And we'll continue to do that on an annual basis. That just gets right to your point where retention and attraction is the number one goal, certainly of employee resources. So we want to make sure that any recommendation that is made does not put Marathon County in a negative position for retention or attraction.
So if you were to design the perfect health insurance system, what would that look like given our size, our market? What would it include the clinic? Would it include selection of specialized providers? What would it look like?
So to a certain extent, there's only so much you can do within a community. You have your on-site clinic, you have the Employee Health and Wellness Center, which is one way that you can help provide access to your employees. But at the end of the day, you have two health systems within this community, Aspirus Health and Marshfield Clinic, that if you go to any type of specialty care or go to a hospital, it will be to a hospital or a clinic owned by Aspirus Health or Marshfield Clinic. So, from a creativity perspective, you still have to access those two systems. And I think what our goal is, and when I work with employee resources, is to make sure that we're developing a plan that attracts and retains employees, because you're competing against not only other municipalities in the area, but also private employers as well. So we want to make sure that we're competitive from that perspective. And a cost, because that's an expensive benefit for the county and for the employees, but making sure that they have access to quality care. The cost is something that you can control to a certain extent. You'll have large claimants that will happen, and you will have no control over those. But what you want to try to do is to control the expenses you can control. And that's why the county has a wellness plan. That's why we encourage the employees and their dependents to go to preventive care visits on an annual basis, and they receive a premium credit for doing that. And various other things that they can do to help control costs that are controllable, like, for instance, diabetes and high blood pressure, et cetera. Those things that preventive medicine can help control.
Is there the ability to push the system from the perspective of we've got good healthcare data relative to cost on certain procedures? And you mentioned that we have basically two health systems with Marshfield and Aspirus. But if we expanded the competition in certain procedures, is there the ability to drive down cost? And let's say that they go to Appleton or Green Bay or to Eau Claire or some other provider. Where have you seen that come into play, and what are the consequences if we're dealing with 13 million and we had an 8% or 12 million and 8% increase? We're basically taking all of our net new construction. And there have been a couple of years where health insurance costs in the counties have taken up all of their new levy capacity. 62 counties one year, their net new construction, the net amount that they could levy, went to health insurance. So are there some ways for us to be more innovative in the design of the system to try to bring in true market competition, understanding that there are things like emergency room, you can't move somebody out of the community, but are there opportunities for us to explore that within our design?
Yeah, certainly there is. Not necessarily, like if you were to look at self-funding, you can get really creative, and some employers are doing that where specific to MRI tests, there are vendors out there that will bring an MRI truck right into the community, and it will be significantly reduced MRI costs. When I say significantly reduced, a health system like Aspirus or Marshfield Clinic might charge $3,000 to $5,000 for an MRI test, and these vendors will charge around $1,000 for that MRI test. So there are ways, and there are also providers. For instance, you mentioned Appleton. There are providers when you get into the certain procedures as far as, knee replacements and things like that, where you're able to negotiate directly with those providers. There is nothing within the community that Marathon County is in, that does those types of things as of yet. But outside, as we go into the east side of the state, there are more of those opportunities, yes.
So Molly, what are you looking for today from the committee?
The opportunity to explore self-funded options. We're not looking for any commitment to move specifically to self-funding, but to present some cost options, give GHT an opportunity to come back with another number. But we were hoping to come back at the September 7th meeting with more information with self-funded options, prices, and then perhaps a revised renewal from GHT.
So are you looking for a motion of intent on the part of the committee or a motion of authorization to explore self-funding as an option in plan design?
Yes.
All right. Supervisor Hart.
Okay. So I know that a big part of this is based on employee health. This works really well when we have really healthy employees. I think one of the realities we have to face is that we live in central Wisconsin, where we really have a culture that is not healthy in general, no matter if we have a younger population or not. I mean, I'm 30 and I know plenty of 20-year-olds who are not healthy at all. So I think my general question with this is how generally healthy are our employees, and I know that might be data that we can't get at this time. And then on top of that, how much risk are we able to take on, if we don't have as healthy of a population as we thought we did?
So from a general health perspective, it's hard to, go off of the data that we're seeing because you're part of a trust. There's only so much data that they're able to provide to us. So generally, we can't answer that specific of a question, but what we can tell you is we're trying to address those things within the wellness plan. So, whether it be the preventive care visit and requiring, the preventive care visit to get a reduction in the premium, because we feel there's no substitute for that interaction between the physician and the patient. So that's really how we're trying to address those issues that we know, candidly, the state of Wisconsin struggles with all over, not just Marathon County.
Just a follow-up, Mr. Chair.
Go ahead.
Thank you. And then, so with that, and I think that's kind of what we've been going through, is that, I think this could be a good idea as long as we had those in place where we had wellness programs, where we had incentives for employees to be healthier, to drive down our risk. My other question is also just the quality of care. If we were to switch over, would we see, would employees be able to retain their own doctors, retain their own pharmacies, have provided all the services they had before?
Yeah, so the answer to that is any alternative we would look at would be status quo as far as access goes. So it would contain all the same providers that you currently offer to the employees.
Are we a modified PPO? Because I know we went to a discounted rate through Aspirus.
Yeah, currently we went back to
Went
a
back.
open panel, if you
All
will.
right.
So Marshfield Clinic is in that network as well.
Supervisor Leimer.
Are there any differences in the way the two plans would be managed where this would impact our staff or Molly's staff in the day-to-day work with it?
Sure. So because of the way, currently you pay a fee every month, a premium, if you will, to GHT. There's no financial considerations beyond that. So when you start to get into self-funded, there are a few additional administrative things from an employee resource perspective and a finance perspective. So because the claims are actually paid out of a checking account owned by Marathon County, there would be finance considerations as well. We did a study as far as how many hours that would equate to, and we felt it was no more than 10 hours per month to look at that. And Christy, if you want to offer some.
We had been self-funded in the past, so we know how that would work, and we are self-funded for workers' comp. So that would be,
Yeah.
we just moved to that model, where that would be okay with us either way.
Just to give you an idea, so January 1st of this last year, Marathon County moved their dental insurance from fully insured to self-funded. Now, we're not talking about the same level of risk. It's significantly less risk. But through the first 6 months of this year, we've realized already $40,000 in savings by just making that change. That wasn't a change in benefit. That wasn't a change. That was just a switch at Delta Dental. So, I mean, that was a positive reflection of what self-funding can do.
All right, any other questions? If not, I think they're looking for a motion to authorize the exploration of a self-funded health insurance plan and report back to this committee.
I'll make that motion.
All right, it's been moved by Supervisor Marshall. Is there a second? Seconded by Supervisor Leahy. Any discussion? If not, all those in favor of the motion will signify by saying aye.
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 Opposed, no. That motion carries unanimously. Eric, thank you for your presentation. All right. Now, we will go on to the fun part of the agenda. And included, we have the discussion of the work plan, we have the strategic plan, and the update on the ARPA. Craig, do you have a time frame, time commitment?
Is it on? Yeah.
Been way long enough.
Didn't have the right position. As far as reporting back, what we're looking for at executive, they asked to have the committees make recommendations for any changes to the strategic plan as far as any new strategies. There are 3 questions that are in your packet. There's not a particular deadline, but the sooner the better. If September, if I know you're familiar with infrastructure, Supervisor Robinson, or Chair Robinson, we're done with ours. It was relatively easy because we had 8.7, which is the broadband, which that you took care of. But as far as coming with any recommendations, there's only the HR Finance and Property is a support committee for 3 of the objectives, 7.1, 10.6, and 10.12. And I guess if you look at these, to start with the first question as far as the strategies, and there are other strategies in the comp plan that are not in the strategic plan. So are there any strategies you'd like to that you feel should be added to this objective? And we went through that. First we did the strategies, then we went to the outcome measures, and some of them were met already, so we reworded them. There are outcome measures you can change, you can delete, reword. But like I said, if I don't know how much time you plan on spending on it today, but in your September meeting, if at all possible, if you could come up with some ideas so that we could bring that to executive in October.
Again, 7.1 deals with the providing cost-effective and high-quality public safety services. It focuses on consider the potential to consolidate emergency service agencies. The EMS is one of those that is being floated around for discussion. Respond to maltreatment allegations and provide protective services for vulnerable populations. And report every 2 years on the response time with advice from municipalities, reconsolidation, alignment, or targeted education. I think that, again, gets into that issue of response time. Those are the current objectives. We could add new objectives or recommend new objectives if that was the desire. That is under 7.1 under 10.6. It's ensure that future availability of skilled and a flexible workforce prepared to meet the needs of both the existing and emerging industries and technologies. And this morning I participated in a Be Bold Wisconsin seminar hosted by Competitive Wisconsin, talking about broadband, which was one of the components, but they also talked about within that how broadband changes the workforce to allow you to recruit people. Childcare came up as one of those, housing came up as one of those important issues, and the whole issue of how we approach the workforce comes up in there. So I don't know if we have some different outcomes that we would want to think about in that area. I know we've got the child care grant. I know the city and the county participated in the housing survey. I know that there are some members of the board that had some concerns about the county's role, but we can certainly have a facilitative role or a coordinative role in some of those activities. And the question is whether you want to look at those again. And the final area would be in
10.12.
10.12.
Mr. Chair, may I add one thing? As far as the updates too, I know Administrator Leonard emailed, it was on the 4th of July when I got the email, all the updates on the current strategies, the objectives and the outcome measures. And it'll be easy to look at what the progress that has been made on any of those strategies. And some were completed, he had listed in there. So I would just encourage you to look at the current updates from the administrator that was sent out on the 4th of July. Thank you.
So again, 10.12 is maintain infrastructure to support economic growth in the county. So those were the ones that we had a secondary role in, not a primary role. There are other objectives in the strategic plan that we could take a look at. What are your thoughts? You want to deal with that today? Do you want to deal with it at our next meeting? Kurt?
The one question I guess I have is, and I know each of the standing committees are bringing, potentially in some cases, bringing additional initiatives to the forefront. Do we want to wait till we see what those additional initiatives are, and then, I'm not trying to push it off, but I think in some cases, if we're going to be the subordinate or supportive committee, I think we need to understand what other initiatives are being brought forward by the other committees to find out if there's additional work that this committee may need to be doing on some of those. Because I think there is some work on the EMS, I think the child care and funding for infrastructure are clearly items that are going to be pertinent to this committee. Funding for infrastructure, for example. We have a proposal by a supervisor to postpone or delay the registration fee for a period of time and use ARPA funding. We also understand that we're trying to get clarification from DOT as to whether or not that affects our GTA. So, like I said, I'm not against having those broad discussions today on the ones we know, but I think there's additional opportunities to have a discussion from additional items that may be brought forward from some of the standing committees.
Supervisor Hart.
Thank you, Mr. Chair. And just to echo what Chair Gibbs said, I have a real life example is one of the strategies I think that would work well into objective 10.6 would be putting in a child care objective. Develop policies that support affordable, high quality child care, because that would help us develop workforce, because I know that there are a lot of people that is a barrier to entering the workforce. But I would love to see what I think the lead committee for that would be education and economic development. So I would be interested to see if they want to put that in there, but if they decide not to, that would be something that I'd be in support of putting it into the strategic plan in our committee. So.
Thank you, Mr. Chair. And I had had that discussion with Triple ED committee on their last meeting I had with them, and they're going to be discussing possibly adding the child care and affordable housing. And thank you for bringing up the changes that, like I said, infrastructure 8.7 and 10.12, I believe it is, that we have the changes made already, and that's on our last, if you look on the agenda for August 4th, infrastructure. It gives you the changes just for examples to look at to see what our recommendations are. And that doesn't mean it's cemented in stone. It's just the fact that we did go over them. We did eliminate some. We did add some. We reworded some of the outcome measures, and the idea is to extend this for 2 years. This current strategic plan, which is up at the end of this year.
So what I'm hearing is a desire to see what the other committees are funneling through and then revisit it and provide input into what those strategies or objectives might look like. Everybody's nodding? Yee, you're not here, so I can't see if you're nodding, but does that sound right?
Yes, I'm nodding as well.
Okay.
Mr. Chair, if I could one more. I know I had talked to Chairman Robinson about this. Since the CIP committee has been eliminated and those priorities were more or less passed off to this committee, is there anything, just to bring it up for discussion, I don't know if there's anything that another objective or another strategy that would help this committee with that CIP project? John.
I could just chime in real quick on the CIP front in the sense that as it's been developed, by my understanding anyway, there's been conversations last year about how to sort of evolve the way we do it. And so in the September meeting, the intention is to bring sort of the, for lack of a better term, working draft of the committee in a more or less final sense to say, here's what it looks like based on those conversations. But at the same time, with the focus being on the capital budget for budget purposes, there's still an opportunity for this committee to look at what that product is and say, here's things that we'd like to see that could align with the objective questions you're raising, and then we could incorporate those moving forward as sort of a two-step process so that moving forward, the CIP would look at the end of both the capital project and the CIP plan itself like you want it to look, in 2023, and moving forward from there.
So what we have, you raise a good point. What we have is a verbal statement of intent to revise the KIP process, and we pull the KIP committee out of the rules, but we really haven't articulated a formal process. Instead, we were looking to administration through the facilities management department to bring in that plan on an annual basis based upon their best professional judgment on what changes needed to be made. But I think that we can truth test whether that system's working when we see that revised list in September, so it would still be timely for our strategic plan. So, good point.
Thank you.
So if there's nothing else, we will look at that. We will capture, try to capture what the other committees have recommended and bring that back here and encourage you to put your thinking caps on to whether those strategies and objections meet our current needs. And we'll go forward at our September meeting. Go ahead, Ann.
Quick question. Will we have that draft before the September meeting then, so we can look at it, or will we get it at that meeting?
We'll try to get it. it's still a work in progress. So we will give you what we have. How is that? It may not be complete. Cody?
Thank you, Mr. Chair. That's kind of the same thing. I don't want to step on any jurisdiction of any other committees, where I've plenty of things that I'd love to add into it, but if it's happening in other committees, I'd like to see the outcome of those. So yeah, I support that.
But remember, we're all equal members of the county board in context of bringing forward ideas. So if you, we have the ability here to put it forward. Ultimately, the county board will make the decision relative to what those priorities are and both the objectives and the strategies. So it doesn't hurt to let a committee of jurisdiction with that expertise develop those. But if it's not being developed, don't be afraid to bring it here. Otherwise, you may miss that opportunity. So valid point to look for those committees of jurisdiction, but don't miss the opportunity. Kurt.
And I would encourage you, if you do have an area and you know that it potentially would fall better into another committee, to have a discussion with those committee members, or at least with the chair, for them to bring up and discuss at their committees. Absolutely.
All right. I think we have a process step forward. Committee work plan. In your packets, you have a proposed work plan, and that is too big of a document, but what we did is we captured what we talked about 2 years ago, and we added to it. And I think what I would like to do today is to begin the process of prioritization, recognizing that your time is a resource, and we only have so much time to invest in things. So what I'd like to do is just run through the list quickly from just a background perspective, and then have a discussion as to what you think might be the more important one. Priority-based budgeting was something that we did do. Hired a firm out of the Denver area to work with us on evaluating programs. And one of the limitations on that was we didn't have the data going into the system to make it a meaningful process. And the question is whether we continue that or we look to the new ERP system to help generate the data. If that's the case, it may be some time before we implement it to begin to understand and look at the data. But we've had some supervisors that have said what's mandated versus what's elective, and that gets into some subjectivity as to what's mandated, because we have to provide law enforcement, but we don't necessarily have to have a bomb team, et cetera. So there begins to be all these nuances to those discussions. Performance standards for programs. Establish policies and commit resources to develop a dashboard for the county departments so we can share to the public how we're proceeding. A long-term facilities plan. Establish goals on long-term facility and project management. Where do we want to be? What do we want to combine? What buildings do we want to get rid of? The tax delinquent property process policy setting. There was recent legislation that changed relative to this. If we take something in tax deed and later sell it, the proceeds go to the previous owner. That will change the game. But as you heard in the audit report, we've got $2+ million of delinquent taxes where we've paid other entities. How do we manage that effectively? And we have spent a lot of time working with Corporation Counsel, Treasurer, Clerk on streamlining that process, but more work needs to be done, and we need to look at that new law and how that might affect us. New position request process and ranking. Currently, the process requires all the departments to submit the request to the administrator. He reviews them and typically presents the ones that he wants to have funded in the budget, but there's no ranking and prioritization. So people that don't get funded have come to the county board and asked that their position to be funded, irrespective of the order or the priority it is within the system. And the question is whether we want to have a priority system. So if there were 10 requests and it's a 10th request that, if 2 were funded and 8 weren't, where did that other position fit in those 10 in context of the county's overall priorities? Evaluation of health insurance, we had that discussion. Policy on the sale, disposition of excess county property. We will have excess property at social services, potentially River Drive. We have numerous holdings throughout the county. What is our policy? How should we go about looking at trying to sell it if we move the highway department and parks? What's our policy going forward? The strategic plan, just a review, property, whether we're primary or secondary, how are we doing in meeting the terms of the strategic plan? The new one is promote cultural competence in county employment policies and in design and delivery of county programs and services. That is directly out of our county board rules, verbatim, and so we need to develop a plan on how we're going to address those issues in terms of employment and services. Customer service expectations, policy setting. Do we want to have certain policies, like when I was at the DNR, you will respond within 1 day. Your voicemail will be current. If you're not in the office, you will say you're not in the office. Things like that. Do we want to have some customer service expectations for interfacing with the public? Tax increment financing, just an evaluation of the program, pursue legislative recommendations and criteria for guiding representation on the local committee. Should Christie be our representative? Should it be a member of this committee or the county board? What criteria would we apply at the joint review boards? Do we want to weigh in on project plan updates, project plans, or extension requests? That's a policy issue. Property insurance evaluation, clarify role of the committee in evaluating property insurance options. Renewable energy policy, now with the recent legislation, determine committee role in developing policies aimed at county becoming more environmentally or fiscally sustainable. And there are some interesting things relative to carbon credits that may come into play in that. And then we added American Rescue Plan, ARPA, and other federal grants just to establish criteria for the review and ranking of projects. We're involved in that process. We didn't capture it last time because it came after the work plan. That is one person's reflection of what the opportunities are. And again, we won't be able to do all of these. Did I miss anything?
I was going to say, what are we going to do next week?
Is this a good place to start? We can whittle down, and one of my suggestions is on the property insurance evaluation. I think that could be a staff function, not necessarily, Molly, it comes in, you and Christy kind of lead that, but I don't know if there's a lot of policy issues in that was a request that we had from administration 2 years ago. I don't see a formal role at this time for the committee. Would you concur?
Yes.
So I think we could delete that one. And I did not want to we did delete a couple, the KIP and the procurement policy, because we dealt with those last time and we've made significant progress on some others. But, so if we can delete that one, are there others that you think we could, are there certain ones that you think are critical? I know Supervisor Lammers, Supervisor Marshall, and Chair Gibbs have all expressed concerns relative to TIF. That would be one, Kurt?
I think the other, there's really, I think, and some of them go a little bit hand in hand. One is a long-term facilities plan, sale of disposition, those two go hand in hand. And then throw on top of that the tax delinquent properties. I think those all three, can get brought together. Well, to some extent, there's a commingling of those, but I think those, we have yet to develop a long-term plan and a plan around disposition. I know we've talked about that for several years in this committee as an item, but I think incumbent upon us is, we have the West Side Master Plan that is being worked upon or being updated at this point, but we also know that there's been talk about a potential highway department, future highway department merger with other departments, but that has languished for a while because of the potential location of where that was going to be, but now clear direction is we've got to look at different, so I think we need to come up with those plans, and they're critical. But you're right, there's a lot of stuff on this plan or on this work plan project list, but I think a lot of them are critical, but I would like to actually move on some of them, try to get some actual progress on them.
So the suggestion to combine the long-term facilities plan with the policy of how do we deal with surplus property, and included in that is the concept of tax deed foreclosures and how we handle that going forward. Is there an objection to try to combine those three together, understanding that there are nuances and other things, but that makes some sense from the perspective of how we acquire, how we plan, and how we dispose of property. So really, we could put that under a property management heading. Does that make sense? I'm seeing nodding.
I would say the other thing, if I might, Mr. Chairman, is, we do have we have a resource, the priority-based budgeting system. However, you and I have also had the discussion that we've understood that the utilization or the benefit of that program is only as good as the information that we put into it. And so one of the challenges, and so I think there may be a period of time where when Workday is finally up and running and available, that we can update that information into priority-based budgeting and possibly be a feeder to priority-based budgeting. So I think that putting priority-based budgeting on hold, at least until Workday is up and running, and that becomes our feeder system to information into the priority-based budgeting for also then departments to work on. Makes sense to me to some extent.
Any thoughts on that? I would share that observation because I think there's going to be so much pressure on the two departments, finance and human resources, just to get that system in place and to work through the glitches that first few months, that realistically our ability to not capture data because it's all what our input is, but to begin to analyze the data is going to be somewhat limited because of constrained resources unless we're going to throw more staff at it. We could look at that once we're comfortable with the ERP rollout. And
do we have an estimate on when that might be up and running? My concern is we're making budgeting decisions now, and there's one budgeting decision with, say, Community Clubhouse that I feel like it's going to save money at the beginning maybe, but in the long term, is it really going to save money when we start to see possible people who aren't getting the support anymore out in the community now being in the justice system? Or so how will that be factored into priority budgeting, even if it's not like a mandated thing? Are the cost benefits taken into account? And can we wait, I guess is my question.
Well, you can wait based upon available resources. And therein lies the problem, is that every budget is a policy statement, and the policy statement reflects the priorities of the board. So as you deal with, we're looking at 1.47% increase in net new construction, which doesn't give us, as a county, much capacity to fund programs. If you look at North Central Healthcare, they have not recovered from the pandemic in terms of revenue and programs, and the question is, where does the levy support go? So the ultimate arbitrator of priority-based budgeting is the county board at budget time. So you have the amendment to do that. That would be, the county can't just say, well, we have to wait for priority-based budgeting to make any decision, because if we do, we won't be able to make decisions, and levy limits will limit our ability. We won't be able to, deal with the wage inequity issue and the pay classification study and other things. So I think sooner or later, ideally, priority-based budgeting would give us the analytical tools in which to do that. I think you can ask the questions and have an expectation that we do a complete and thorough evaluation of the pros and the cons, cost benefits, and long-term cost of programs, but we don't have that capacity right now. That's the fear.
Mr. Chair, just if I could just make one comment.
Right.
I just wanted to let everybody know, if you didn't already know, that Workday does have its own data analytical tool within it. So along the lines of, as we accumulate data and there's knowledge transfer through migration into the next system, that tool will allow us to get more of a read now on some of the sort of potential things you're speaking to that right now you can maybe see, but it's hard to connect the dots on some of them. But with that new system and that tool, it should shed more light. And I know that Administrator Leonard's also wanting to fund a data officer. So those two things in concert should help move things along. And even if you continued with the same vendor, for instance, allow that analysis to be translated in a way that, highlights more of the operational value versus what you see is just kind of intrinsic value of data that you're not totally sure how it reflects in what you're doing day to day. So there's definitely light at the end of the tunnel anyway when it comes to that.
All right. I would suggest that one of our priorities needs to be to promote cultural competence in county employment policies and in the design and delivery of the county programs and services, given the fact that we abolished the Diversity Affairs Commission and said that the county board would own that issue in the thought that we would look at what our policies and procedures are. We haven't done a lot to date. I know that there's an expectation that we do that, and I think we could take part of our informational meeting to get the updates on that. But I think if we don't, that we're not fulfilling the promise that we made. Supervisor Leahy.
Thank you, Mr. Chair. Just wanted to point out that one of the last tasks that the Diversity Affairs Commission was kind of undertaking was looking through HR policies, just specifically looking at language updates, just anything that would kind of clean up our language, modernize, make sure that we're being as inclusive as possible in those guidelines and policies. So I'm not quite sure where that ended up, but it might be a place to start that would make sense for this committee as well.
We can try to track that down. I'm not sure what shelf it's on or what folder it's in. But I think it's on a shelf or in a folder, and it's not necessarily visible. So you raise a good point. Woody.
And then in terms of priority two, one of the things that I wanted to see moved up to was ARPA funding, specifically relating to establishing a criteria. And that's mostly because within the next 2 years, we will ideally be spending all of that. And at the same time, we're accepting things for ARPA, and that money that fund is drawing down. So we might get to a point where we're going to actually have to make decisions because we have more requests than we have the ability to spend. So I think that should be a priority, not only just because it's going to be what we're dealing with in the next 2 years. And I don't know if ARPA funding goes beyond that.
Could I suggest that perhaps we wrap our strategic plan and the ARPA and the grants together from the perspective of a committee work plan? Is that, we're sort of the arbitrators of allocations. We make the recommendations relative to commitment of resources, whether it's personnel or finances, to accomplish those goals. And I think that might be, in light of the discussion we just had, a way to capture both. Does that make sense? Anything else? I know the health insurance, we sort of started that process, and there will be things that will be not top priorities, but rather we will get reports and updates on them. And I'm not saying that if it's not a priority, we're not going to talk about it, but I think we, as a committee, need to schedule that second meeting of the month around those top priorities, and what we can do is see where we're making progress, and if we make sufficient progress, look for other opportunities to replace it. But what I'm hearing is TIF, the property management, the that whole issue of strategic plan, ARPA, meeting our goals, objectives, strategies, and that cultural competency given the directive from the rules. So those would be, does that make sense for the 4 priorities at this time? I'm seeing nodding. What we'll do is we'll capture that and bring it back one last time at the next meeting so you can get it in writing in front of you. Kurt?
Chairman, thank you, Mr. Chairman. The one thing, if we are going to take on tax incremental financing and look at what the county, what the county's role is, and if there is recommendations that this committee has potentially to statutorily tax increment financing. The time to take that up is early in the next legislature, because if we want to advocate for potential legislation change, it's better to do that early in the legislature period that starts in January rather than later, simply because it gives us a better opportunity to potentially get something through.
The time to do it is actually now, not
Correct.
wait till January.
Right. No, I don't disagree. I just think that if we're going to take that up as a priority project, and we want to do some analysis, we're going to have to do that analysis, start doing that analysis now as to what the county's role is.
So what we did last time is we sort of identified who on staff would be the lead for these. If we prioritize them, we'll work with administration to identify what that might look like. So we have to fit into their workload system. I imagine that Christie, on TIF, it will be Michael, administration, Christie, and others. So we want to be sensitive to their capacity. So we'll look at trying to ferret that out as we go forward. All right, I think we've got a path forward on that through consensus. The final thing in your packet, I just wanted, Supervisor Hart had asked sort of where are we, and we gave the report at the last county board meeting relative to where we are with process, and we've got another round of requests coming in October 1st, but we are spending down the resources. I talked to Jim Griesbach this afternoon, and he's optimistic that all of the bridges might be funded in the request. He's not so sure that all of the other highway projects are there, so we will need to monitor those programs if the county board approves them tonight to make sure that we can spend that money by 2026. If not, we need to readjust. But we have, you have the list of what was withdrawn, what we didn't fund, what is in the budget, or what we kicked off for the budget process, and that will come back to us in the context of the administrator's budget and or the capital improvement plan. Some of those may be meritorious for funding. If we don't have ARPA dollars, they'll need to look elsewhere. And then we're, in those that we have before the county board tonight. Christie pointed out that we have not formally taken action relative to broadband. We have taken action in context of our developing a county board policy that passed unanimously relative to supporting the applications to the Public Service Commission. We, at that time, supported the applications for Serenity, which was not funded, for Frontier, and for Bug Tussle. We made some commitments in terms of funding on a per capita or per person served basis based on the grant, as well as a commitment to explore the possibility of a loan to Bug Tussle. We are having a meeting with Bug Tussle next Thursday to talk through what that might look like. That may change where we go with the ARPA funds in context of what we've allocated or committed to. But we will need to bring a formal resolution back to the county board to formally designate it so she can report it to the treasury going forward. But we have $41.5 million of projects, $26.3 million of funding. A number have been withdrawn. Some we've decided against, but we basically have about $5.2 million unencumbered if the county board approves it tonight going forward. So we will need to, on a regular basis and probably on a quarterly basis, go back in and readjust those. For instance, we put $500,000 aside for the paid time off balance liability reduction. We spent $160,000, so we've got $340,000 that we can recapture and spend elsewhere. So we'll need to adjust those numbers going forward. So, Cody, while we may spend the money, there will be new opportunities because if we don't spend it, we lose it. So we'll have to be on top of that. That will be one of those things that the committee, we will have to be realistic. And if there's a question, and we heard this from Milwaukee early on in the process, is that they just couldn't move some of the projects because of supply side issues, engineering design issues, other things. We'll need to stay very much on top of that going forward. But we'll try to update this on a regular basis for you. So you've got it and present it to the county board. If that makes sense, we'll see what we get in the next round. I know that there are several groups outside of the county that have requests that are floating. There's unlimited needs or unlimited wants. So what we'll try to do is, as best we can, keep you informed and break it down like this and provide it going forward. Is there anything else that you need or would like relative to ARPA tracking? All right, we will keep proceeding along these lines. All right, we talked about talking about when our next meeting date is. And we are scheduled to meet on the 7th. We will have a special meeting with Portage County on the 14th. And then we will have our regular meeting. Come fall, we're a little busier. And I apologize for that. I think we need the meeting on the 7th. We have a lot of issues coming at us that are relevant to the budget that we need to get through the capital plan. Some of the budget assumptions, updates, and other things. So why don't we hold those? We'll look at the 7th, and if the 14th, if we don't need the meeting at the end of the month, we'll cancel that meeting, but we'll go with the 7th and 14th right now. Go ahead, Allison.
Sorry, can you just confirm what time the 14th is?
5.
At the airport.
At the airport.
And the problem we talked about, could we move this meeting to that date? We've got the requirement that we video record or show these live, and
I checked with Michael. Couldn't find it in the rules.
Oh.
Provided the rules anywhere.
it's not a rule. Okay, then I stand corrected.
Nope, that was, yeah.
We try to provide the public.
So, yeah, it's a recommendation.
It's a recommendation that we provide the public access through YouTube, the YouTube station, so we'll look at that. So we do have some flexibility. But I think we should try to make sure that we're transparent as possible, particularly when we're making decisions. Okay, we could do it.
The September 14th meeting is a requirement of the airport that you have the joint finance committees of Portage and Marathon County. Review and approve the airport budget. So that's what that meeting is about. So it's actually you and Portage County that will be meeting and discussing the airport.
So we will record it. We'll make it available to the public. And if that's the case, then maybe we'll look at moving the second meeting up to that date. And then potentially meeting at 4 with this committee, and then 5 with the joint committee. All right, anything else? If not, a motion to adjourn is in order. Moved by Gibbs, seconded by Hart. All those in favor?
Aye.
Aye.
Opposed, no? That carries. Thank you all.